Okay, it's recording. Hi, I'm Gwen. I am a licensed marriage and family therapist associate here in the state of Washington in the United States. This is the second video in my series on trauma. This is the second edition of the second video. I published some videos back in December, I believe, of 2017, December or January, and this is the new set. And this is the second of a four-part series. And I'm talking about trauma. And today I am going to talk about um, today in the essay that goes with this video, I talked about the physiological impacts of trauma. And what I want to talk about in the video is the importance of having trauma care providers, and be that our therapists, absolutely, our psychological therapists, our psychotherapists, absolutely. But also our medical doctors, our massage therapists, any of our body workers, any nurses or medical people who we see, uh, anyone and everyone should be trauma informed to a degree, right? Um, I believe anyone who works with people, who works with people's bodies, or who works with people's minds should understand how trauma impacts us physiologically as well as psychologically and emotionally. Um, Trauma has so many ways that it impacts us. And while, I absolutely believe in modern medicine, I absolutely believe in the good that modern medicine can do and has done and does for many, many people, myself included. Um, there's also a truth that it can't cure everything. And that when we're trauma informed, we're able to understand some of these roots of some of our illnesses. And not only can we understand the roots of some of our illnesses, but we can also understand how to treat people, right? And I don't mean just how to treat people medically, but how to interact with people. When women go in for our annual gynecological exam, having someone who's trauma informed, who's touching us, um, is really, really important, right? Particularly if we've had sexual trauma. um, that whole procedure is a little bit on the barbaric side in and of itself. But when we have trauma that lives in us, it can be exponentially worse. It can be incredibly triggering. It can knock us off our feet for days, if not longer. It can be a really incredibly horrible experience, and yet necessary for us to, make sure we're not getting cancer, right? Um, so to have a doctor who's very um, knowledgeable in how trauma impacts people, how to tell you, I'm going to touch you here, and this is how I'm touching you, right? This may feel like X. Are you okay? Do you need me to stop right now? I'm going to stop for a minute because you seem to need to get a breath, right? All of this stuff, and not doing that with any sort of tone or shame or, whatever passing on, but in a very like understanding way. This is also true of, not just invasive exams, but our massage therapists, right? Our chiropractors, people who are doing acupuncture on us. They all need to understand how touching certain parts of our body, and it's not always our genitals or our breasts or, our private parts. It can be, for some people, it may be their shoulders that are holding a lot. Most of us hold a lot in our shoulders, right? It could be a part of their back. It could be one of their legs or their arms, right? And so to have a provider who understands a response that is happening with a client, with a patient, understanding that that may be coming from a trauma place, and then how do they help that client soothe their system and get present and move out of that triggered space is vital, right? It's vital. So I really encourage folks, really, 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 really encourage folks to find people who are trauma informed. Unfortunately, trauma informed is becoming a buzzword, and many people are claiming to be trauma informed who simply are not. And so you need to do your own research and you need to know your own stuff, unfortunately, right? Or fortunately, I mean, we should know what's happening with ourselves, right? But sometimes we do need to know more than our providers, and we need to sometimes educate them, right? Or at the very least, we need to know what kinds of questions to ask, right? Simply asking, are you trauma informed? In this day and age, 2018, many people who shouldn't be saying, of course I am, um, aren't, right? And so you need to be able to ask more detailed questions. How do you do exams? What happens if I get into a triggered state? What will you do? How will you respond? What tools will you give me to come back to the now and move out of that triggered space? How will you help support me? How will you, right? All of these kinds of questions that are really important to ask when we're looking for care providers and when we're hiring care providers. And this includes our therapists, right? Because unfortunately, there are many people in psychotherapy who work as therapists, who work with trauma, who probably shouldn't, right? This is same. It's the same is true in the coaching world. The same is true, it's just true. Um, there are people who I believe have the best of intentions, the absolute best of intentions, and yet because they don't know enough and they don't know what they don't know, right? They can cause incredible harm for people. And that's scary. That's scary for me as a provider who's trauma informed, and like my life revolves around researching and studying and understanding trauma and how it impacts people, and working with people who've experienced trauma, right? Who have complex trauma. And it's not an easy task to learn all this information, right? It does take time. But if we're good providers, we're taking the time to do that research. So I think it's really important for people to be trauma informed, both as ourselves, as consumers, clients, patients, but also as professionals offering services to people. So, the essay that goes with this uh, talked about the physiological impacts of trauma. And if you're watching this on YouTube, you can see a link to that essay down below. If you are reading this on my blog, well, you've already read the essay. If you're reading this as a part of my newsletter, you again have already read the essay. So I hope you found it informative. This is all in an effort to introduce the Trauma Informed Embodiment Level 1 program that I offer. It's an online program, and we work through, I offer you tools in soothing your nervous system, self-regulation, boundary work, um, grounding and centering work, and resources and resourcing. And there's a lot of psychoed that goes into that also. What is trauma? A, a deeper explanation of the physiological, psychological, and emotional impacts, a deeper understanding of attachment and our basic human needs of belonging. Uh, there's a lot of information in the course, as well as lots of practical tools for you to use to help your system regulate, to help you be present, to help you have boundaries, to really do that first phase of trauma work, which is safeness and stabilization, and giving you the tools so that you can self-regulate, so that you are then able to dive into your own deeper trauma work. I really recommend that folks do the program in conjunction with individual therapy, whether that be with me or with your own individual therapist. It is important. It is not a processing program. It is not a therapy in and of itself program. It is definitely psychoeducational and offering you a lot of really good tools that many people have found incredibly helpful. Okay. Links to all of this is below if you're watching this on YouTube, and also below if you're not watching it on YouTube. Okay. I hope you have a great rest of your day, night, whatever time it is. And I'll see you again next week. Okay. Bye.